I'm curious to know why it causes the tingling and the numbness in the fingers and the hands.
So in carpal tunnel syndrome, the median nerve is being pressed within that tunnel, and that nerve gives the sensation to the fingers, mainly the thumb, the index, the middle, and part of the ring finger.
Okay, and can you tell me why repetitive hand movements, like typing or using tools for somebody who's in construction can increase the risks for developing carpal tunnel syndrome?
With repetitive motion, what happens is that there's swelling within the carpal tunnel itself. It's kind of like when you go to the gym and you exercise a lot and your muscles sort of expands.
Yeah.
And the expansion causes the increased pressure and pressing on the nerve, which results then, again, in the numbness.
And why is it more common in women than in men?
Because the anatomy is a bit different. The carpal tunnel is a lot smaller in females, so the cross-sectional area is smaller. That results in a tighter sort of tunnel.
Why people with certain health conditions like diabetes or rheumatoid arthritis are more prone to CTS?
Basically, patients with diabetes and rheumatoid arthritis, there's inflammation that occurs. And with inflammation, there's swelling around the tendons. It presses on the nerve, and then the carpal tunnel sort of sets in.
And can you tell me why symptoms tend to be worse at night?
Because patients are resting, they're asleep, and that's when the swelling starts to accumulate. And that's also because they're not doing things which distracts them from the numbness, and that's when they feel the pain.
Why wrist splints? Why are they often recommended as part of the treatment for carpal tunnel syndrome?
In the wrist splint, what it does is it keeps the carpal tunnel in the widest position as it can. So it's normally kept in a wrist in a slight extension at about 30 degrees. So in that sense, then it keeps that tunnel open. There's less compression on the nerve, and the symptoms sort of gets better.
Can you tell me why some cases require surgery while others can be managed with non-surgical treatments?
In certain causes, it could be reversible. So someone with diabetes or rheumatoid arthritis, if you treat the condition well and it's well maintained. But in certain cases where the tunnel itself becomes fibrous and tight and it does not improve, then we will need surgery with that. The longer the nerve has been pressed, most probably will be irreversible sort of damage done. So even with surgery, even if you release the pressure, the nerve itself has been damaged and there is no recovery from that. So the earlier you get it treated and sorted out, there's a better chance of recovery.
Can you tell me why lifestyle changes and modifying your work habits and everything can help alleviate the problem?
So by modifying and with good ergonomics, you're keeping that carpal tunnel cross-sectional area as wide open as possible. That will decrease the pressure within the carpal tunnel and decrease the compression of that nerve itself. So with decreased compression, then the symptoms will slowly get better.
All right, well, thank you so much, doctor. That was really informative. We appreciate
More than welcome,
it.
Mike.
Yeah.
Thank you.